Okay, so I'll try not to be as all over the place as possible, but ADD and just everything, I get distracted, and my lovely cat assistants, well, wherever the other one is, I'm just going to have a little chit chat, kind of a rant about certain aspects, but about the coronavirus thing again. But this, a few days later, and these are observations, and very fact-based person. I like to get all the pieces. I don't want to just buy into one thing. And that's a lot of the problems I see with people who like get so angry on Facebook. Is like they take one aspect and they run with it, and they get so mad about something when they're not looking at the whole picture. And then when you're in a pandemic, it's people are running on panic and fear, and that sort of reaction intensifies. So unfortunately, with a situation like this and the forcing into social distancing, there's just so many huge issues with this. Unfortunately, I made an observation pretty early on that people are starting to realize as it becomes more real for them is social distancing. You're going to see a rise in depression and suicide rates. It is what it is. It's not even being hyperbolic or exaggerating. We are social creatures. I've already felt myself going through it because all these things that I planned are getting canceled. I've had NakaCon, they did not postpone. It is officially canceled. Animal Corolla canceled because St. Louis is not allowing any gatherings over 50. I think the whole state of Missouri, actually. Pretty sure Anime St. Louis is getting canceled because it's within this 8-week window that St. Louis County and the surrounding counties all put out as a standard. Interviews canceled, and it's in a 9-week window, but they just decided to cancel and roll the tickets over the next year, which I think I'm most disappointed about that one, because I've been talking about, I've been planning stuff, and it just, when you take all these things, and I'm not the only one, I'm speaking from my own experience here, but this is what, the more things are getting canceled, because the interviews thing just happened yesterday. Today's the 17th. Very early on the 17th, it's like 6:40 in the morning, because I work third shift, so this just happened yesterday, late afternoon. So, there's a lot of people that had smaller things canceled, like concerts, and like, yeah, they're upset, but they're like, well, it'll probably get postponed. There's some people who are a little more mad than others. Some of the convention people were disappointed. They're trying to like figure out ways to like make up for the NakaCon situation. But a lot of these people who were planning for interviews, and like I honestly, like, I feared it would get canceled, but I didn't think we'd hear about it that early, honestly. So it really shocked a lot of people that they made a decision that early. And so people had the reactions I expected. There was a lot of disappointment, and a lot of people where that's their one thing, because I've been in a situation most of my life where I was at or below the poverty level. Only in recent years did my job even become like, or that my income was even like lower middle class, and now I'm playing the catch-up game. So I'm still like in this, like, I'm catching up, paying off debts, trying to get my life right so I can actually like move on to this next stage in my brain where like I want to be able to get a house and like, whatever. But I have a lot of friends who, like, they're where I've been for most of my life, income-wise, and they get one thing a year that they get to look forward to and that they get to do, and they plan up and they save their money so they can do this one thing. And for a lot of people, that was interviews. That was their one burden. Or maybe they had two things. Well, they have something earlier in the year and they have something later in the year. Well, their earlier year plans got fucked, so there's a lot of people that are already feeling a very strong impact of just having this extreme disappointment and, like, not having this thing to look forward to. And it can be really devastating to people. And this is just like this is an aspect in the spectrum of social distancing. Because when you know, if something gets canceled, people get upset, but then they try to make other plans. Well, you can't do anything, really. Because they keep lowering the amount of things, and they're closing all the bars and the nightclubs. Like, I'm not a bar hopper, I'm not a nightclub person, but some of these people, some of my friends, you know, they would make up for these things, like making a plan, like, oh, we're gonna book out this bar, because they have a couple of them. We're gonna book out this bar, everyone come out or something, you know, do that sort of thing. I can't do that. They can't really do much of anything to make up for it, except for maybe hang out in small groups. But then there's people trying to shame anybody who hangs out in more than like 5 or 6 people in a place, because you're not self-quarantining or you're doing something unnecessary. No, having a social life is necessary to people's mental health. This is a huge problem with social distancing. And the more shaming, and it's just, you're making people feel bad for pursuing a need. And that's something I have a problem with. So, you will see people, especially people who live alone. Like, I at least have my boyfriend here, and I have my cat assistants, as I'm gonna call them today. I have my boyfriend here, and I have my job. My job isn't going anywhere. Like, I'm one of those people in a service field, like security. They always need security there. It would take extreme measures to keep me from my job, outside of getting sick. But even then, I basically work alone most of the time anyway. And especially now that they've pretty much went down a skeleton crew for the offices and data center I work for, almost nobody's coming in. They have them all working remotely. So I'm just there to be a camera grunt, do my rounds, make sure nothing's blowing up. That's my job. And we're there for insurance purposes. So my job is secure. I'm not worried about mine. I am worried about my boyfriend's job, because he does shower installations. So I am worried about his income. It's just a tough time for that too, because we're trying to get his financial stuff in order, and right now it's okay, but I am worried about his. Anyway, so going into social distancing stuff, I think there's a way. I mean, people need social interaction. We're social creatures. There's got to be a healthy amount of it. Like, you got to find a balance in the situation that we're in. I do not like the people who are trying to shame people for doing what's natural. That's going to make the situation worse. I mean, like I was saying, I'm getting a little sidetracked here. People who live alone are going to have a harder time too. Especially if they're already prone to depression. They are more at risk for suicide in this situation. This is just an undeniable fact of the situation. The more social distancing we have, and the longer this goes on, you will have more suicides. Plain point fact, it is what it is. And I think this becomes a situation. I said on Facebook to my people, pick your poison. I think my thoughts with all these restrictions stuff, if you over restrict, you're not gonna wipe the virus out. You're extending the fucking pain at this point. Like, there has to be some amount of spread to start building up some kind of community protection. Once people get over it, hopefully, there's some immunity built up, and that will slow things down. Now, you don't want it to spread rapidly. You don't want an Italy situation. But here's another thing. The Italy situation, there's a lot of things that are being ignored about that. The fact that Italy has like the second highest elderly population outside of Japan, like the over 65. So that's part of the reason why their situation got as bad as it did. Another aspect of that is Italy has a very close, touchy-feely, like kissing is a very common greeting, either peck of the lips or a peck on each cheek. When you're in a culture like that, and in close quarters, because it is a smaller landmass, and you have a lot of people in close quarters, and you have an elderly population, you have a recipe for disaster very easily. So, them not addressing it wasn't the only problem. Them not addressing it soon enough, everyone makes it that and keeps trying to use an example for the United States, but we aren't the same. We are not the same. We are somewhere like in between, because I was having a conversation. Japan has one of the highest elderly rates, and they do not have the same issue that Italy did. But Japan is kind of the exact opposite socially, where they're not overly affectionate, especially in public. They're just, it's not really considered courteous. So it's a big cultural difference, but it's making a difference in the way things are going in Japan. And from what I see of friends that are out there visiting or living thus far, is that they're not really panicking out there. Like, things are just business as usual. If someone gets sick, they're quarantining themselves. And I think this is another thing with the Japanese culture, where there's this very politeness and this social decency thing, where I could see anybody in that country, if they felt the slightest bit of sickness with this going on, they would self-quarantine themselves. That would just be a cultural expectation of them. So, you have two completely different cultures, where you have one where it really hasn't gotten that bad for having a higher elderly population, and then you have a very touchy-feely, warm community, culture, whatever. My words are dying here, but where things exploded, because it's just different culturally. So, I do not think the United States will become Italy per se as far as things go, even if people are breaking a lot of the idea of social distancing. You're gonna get people who pass away, obviously. It's gonna happen, unfortunately. It happens every year with flu, it happens every year with, I mean, heck, there's still people who die of cold complications if they're old enough. It's rare, but, everything has a risk. We have another big issue here in the United States, too, which is gonna make the panic worse, or is making the panic worse, which is overinflating the death toll by a lot. Your death percentage toll, I think it's probably a bit lower than they're even saying it is, because people aren't getting tested. They're refusing people testing unless they are requiring hospitalization, or they have somebody who already was confirmed to have the virus, and they have that person's name. They can't just say, oh, I was here. Nope, they don't get testing. They are only saving testing for people who meet specific criteria. And there are so many posts. I'm in so many different Facebook groups for like podcast and like couponing and just all these different things, different communities I'm in. And I see these stories time after time after time. I've seen hundreds from different people where they've tried to get tested. They have all the symptoms. They are having trouble breathing, and they told them if they're not about to die, go back home and self-quarantine, basically. Like, we're not going to test you unless you need hospitalization. So our cases are way higher than what are being reported right now. But this also means our survival rate's going to be way higher. Because there are plenty of people, and you're already going to have skewed numbers because there's a lot of people who aren't getting all the symptoms or aren't getting the main symptoms. There could be people that are walking around with like just a slight fever and like a headache and like a little fatigue, and they got the virus, but they'll never fucking know it. They'll just think maybe they got a mild case of the flu. That's the problem. You have all these symptoms, and there's certain percentages. Yeah, fever is the most common one, but it's still only 88% that get it. The cough is the next most common thing, and I think that was like 60-something% get the cough. The breathing problems is only really in the severe cases. It's frustrating. And this is partially because of Donald Trump's fucking dumb ass refusing test kits from WHO earlier on. So now they are rationing the few kits they have, but it's severely skewing the numbers to a crippling degree, which is gonna be the actual problem. Because then you can't accurately get a real idea of what the situation is. It may not even be as bad as they're thinking. There could be a possibility that if you treat this thing early on, when it's not as bad, that it's not that hard to treat. Or there could be something that helps people early on so it didn't have to get to severe stages. Because there's also stories of people who end up needing hospitalization after they tried to get tested 3 different times. For some of these people, tried getting testing, they kept getting turned away until they needed hospitalization. That was probably completely unnecessary. There has to be some type of intervention, but they're so focused on severe cases that they're not. I think this is inflating death rates too. It's making this thing worse than it. I think when it all pans out, it will basically be just a worse, like comparable to like a worse flu. Like sometimes we have flus that are more potent or tougher strains than other ones. So, and especially after like a vaccine is developed and in the works, I'm pretty sure that death rate is going to be like right around the same area. So don't sit there and call people ignorant if they say this is no different than the flu. Okay, maybe they're coming at it from an uneducated stance, but there are people who actually look at what's going on, the whole picture, and can see that in the end, it probably won't be any different than the flu. Yeah, the flu kills people. That's just part of life. This virus is going to kill people, and it will continue to kill people. Even after they get things contained, it will probably still go around for a while. That's just, unfortunately, how sickness is. Cancer is killing people every day. We have so many things. The flu's still killing people every day. It's just a part of life now. But the stupidity of the system is making things worse. It's making things way worse. I have a lot of thoughts on this, obviously. I wish people just were a little more sensible. I had a little more sense about things. I wish the system wasn't so fucked. The US government system in general is just fucked. the healthcare system's fucked. Just everything is so fucked right now. People are fucked. The panic buying, all this shit, shortages of medical supplies. We've doomed ourselves to some failure. If we were actually more prepared and smarter and more sensible about things, we wouldn't have to do all the shit we're doing now. It's really fucking annoying. Really depressing. I'm like somewhere between pissed, annoyed, but my depression is like the strongest piece of this. And like even my boss could tell that I was just like beyond depressed yesterday. He's like, you doing alright, Nicole? I'm like, He's like, yeah. He's like, I understand. He's like, kinda miss you bantering with me and giving me shit. I wish you'd cheer up. Cause I give my boss all kinds of shit. But it's all in fun. It's kind of like a respectful, like, I can be a little hard-assed about things, but like in a respectful way with him. Like if I have a problem, I can be real tough about things, but like he respects that I'm honest with him, and like we have no beef. And I'm a good employee, so. But I'm having a rough time with just the things, all these things that I had planned, I'm looking forward to, just poof. And then there's other things I'm worried that will get canceled that are in June, in July. I'm really hoping people can get their fucking shit together. And I'm gonna say it like that, get your fucking shit together. Stop fucking up. And let's wrap this shit up, please. I know that's an oversimplification, but like at this point, like, fuck! This is just my frustration. I don't want anybody coming at me like, oh, you're like being ignorant or you're doing this bullshit. No, just shut the fuck up, please. It's not like that at all. I'm coming at this from like a observational, logical stance of like, here are the facts, these are facts, these are people's stories, this is what I'm observing, this is the fucked upness of our healthcare system, and this is the fucked upness of our fucking government right now, and Donald Trump, like, his dumbass could be to blame. Honestly, his dumbass is the blame for why things even got the way they got. It's like this little, you want to talk about trickle-down economics, there you go. Trickle-down fucking, fuckonomics, as I like to call that. Donald Trump. Trickle-down fuckonomics. Hey, there's your new slogan, 2020. I mean, goddamn. I'm gonna stop this ranty doodah now. I hope my points are as well received as they can be, and maybe this can inspire you to research more into things and actually look up the facts. Look up those things that contributed to the mess. Look up all of the stats for Italy, where you can see the contributing factors. It's all there. Just please feel free to research it. You don't have to take my word for it. You can find this stuff if you actually look. Don't look at all biased sources. Look up multiple sources. They're out there. Look at numbers. Enough research. You can find answers. I encourage everybody, do your research. Be informed. Always be informed. Be cautious, but also take care of yourselves. Like, not just the physical being, like, of course, wash your hands, sanitize, do what's good for your personal environment. I have my lovely air purifiers in here. It's just a nice little extra thing. I had them before, but, extra step, keeps the air nice and clean. They got the HEPA filters and all that. Get yourself a bidet, man. People are finally getting on the bidet train because I'll TP. I go by that though. Get you a fucking bidet. I got one. It's lovely. I'm hoping, you know, at least all this TP scare improves people's ass health, for real, though. You know, stay informed, stay woke, whatever you want to fucking say. You know, stay up on the facts, follow the CDC. Also research outside of CDC, because sometimes they're not always, like, 100% up on things. Like, they're fine for, like, your kind of base level. That's more what I'm saying. I don't want to say, like, they're misinforming. I just want to say, like, they'll give you the basic stats, but you need to also look at contributing factors. Educate yourself. All I can ever do is promote people to educate and inform themselves from the most non-biased perspective you can. Some people are better at it than others. Really be open to more than just your personal thoughts, which can be hard. I mean, I listen to people that I don't fully agree with. I listen to a lot of podcasts. I take other perspectives in. I don't have to agree with people's perspectives, but, you know, to be a thoughtful debater, to be a more informed citizen, you need to have all those things. You need to have all those aspects. You need to consider all the what ifs and all the aspects and take all those things, kind of like a scientist. Take all your facts, make your spreadsheet, come up with your solution or whatever. Anyway, stay woke, stay informed, stay safe, take care of your mental health. Mental health people, find a way to get through it. Pray if you pray, meditate, do whatever you think's gonna help in these times. Just, you know, just take care of yourself. And subscribe if you want, because I post random shit, y'all.